Hi, everyone. I'm Cassie Goodman here with Nevada Cancer Coalition and Dr. Hoang from Digestive Health Associates in Reno, Nevada. Thanks for being here today.
Hi, Cassie. Thank you for inviting me for this discussion.
So Dr. Hoang is a board-certified physician in internal medicine and gastroenterology, and she's going to be talking with us today about screening and early detection recommendations for colorectal cancer. So first question, at what age should someone of average risk for colorectal cancer begin having screenings done?
So my recommendation is that before the age of 45, patients should definitely talk to their primary care physician regarding screening, especially for females once the same age around getting mammograms. They should also discuss colonoscopy screening, as it's been shown that there's an increased rise of early diagnosis of colorectal cancer before the age of 50. And so some guidelines are proposing at the age of 45, we should start discussing colonoscopy screening.
Oh, that's great. And I love how for women you paired that with mammograms so they can have both conversations at one time. So talking to your doctor before the age of 45 and looking at maybe getting screenings done starting at 45. So let's say I turn 45 and I have my screening done. How often can I expect to have to redo that screening?
Well, a repeat colonoscopy is based on the patient's family history of colorectal cancer and also to genetic susceptibility and hereditary colorectal syndromes, as well as personal history of adenomatous polyps. So for someone who has no history of polyps or family history of colorectal cancer, the recommendation is 10 years, and especially for a normal endoscopic evaluation.
Awesome. And what if I choose to do something like a FIT kit instead of a colonoscopy? How often would I need to do that?
Well, that's a good question. So there are various types of fecal tests. First, I'd like just to give a quick overview of the types of fecal tests we have. First is the FOBT, or fecal occult blood test, which is a smear test that just detects blood anywhere in the GI tract, from the stomach, the small intestine, to the colon. And that's very nonspecific, and the recommendation is annually. And keep in mind, medications as well as dietary issues can cause a positive test, such as ibuprofen use, eating red meat, and so forth. Now, the second one that you mentioned is the FIT, or the fecal neurochemical test, which is also similar to the FOBT test, in the sense that it's a stool smear test. But the thing is that it actually checks for antibodies in the stool. And because there is about 20% to 30% miss rate on cancers, the recommendation is an annual screening. And the third is the Cologuard, which is the stool DNA test. And that's more specific in the sense that it checks for DNAs in the stool that's specific to cancer. And interestingly, it's an entire bowel movement you have to collect. And that test is screened annually. So it's more specific than the other two tests.
Okay. So those tests you just talked about, they all seem to be annual, whereas if you go with the colonoscopy, you wouldn't have to do that quite as often, although it is more invasive of a screening.
Yes, exactly.
So for people who may be of higher risk for developing colorectal cancer, we already talked about everyone should start talking to their doctor before the age of 45. But if I determine with my doctor that I'm at higher risk, at what age could I maybe expect to start my screenings?
So as previously stated, it depends on family history. So I believe that, once you meet with a family physician, they take a thorough history of family history. So patients who have hereditary colorectal syndromes, such as FAP, also known as familial adenomatous polyposis, screening is done annually for that. And for those who have Lynch syndrome, screening is as early as the age of 20 to 25. And it's every 2 years up to the age of 40. And then after that, patients should be screened annually thereafter. So it's based on the family history, and that's very important in the discussion with the primary care physician. And of course, they'll refer you to a gastroenterologist, and we'll also give you more consultation on that too.
Great. So very important to start talking to your doctor at an early age to find out when you should start that. And now I've also heard that colonoscopies are not only used for early detection of colorectal cancer, but they can actually be preventative. So is that true? And if so, how does that work?
Yes, that's very true. The goals of colonoscopy are to identify and remove polyps. And the goal is to early detection versus, in other words, prevention versus detecting the cancer. And in the setting of a colonoscopy, it is done by an experienced gastroenterologist. Screening is done where polyps are removed in one procedure and sent to pathology. And the pathology will tell the patient what type of polyps it is, such as a hyperplastic, which is non-cancerous, versus a precancerous lesion as like an adenoma. So therefore, it is a cancer prevention measure.
It's great. It's great that you have the ability to remove those before they become cancer and prevent it altogether. Now, what about for our survivors out there? So people who have already been diagnosed in the past with colorectal cancer, can they expect to be following different screening guidelines going forward after that diagnosis?
Yes, the guidelines is actually very extensive regarding the type of cancer, if it's rectal cancer or localized cancer. But generally, if a patient had resection of the colon or the rectum, screening is 1 year after the procedure. And then afterwards, after the 1 year colonoscopy, they'll get a repeat in 3 years. And then after that, 5 years. And after the 5 year intervals, screening should be based on just the general surveillance guidelines.
Great. Thanks for explaining that. Is there anything else that you would like to add today about screening recommendations for colorectal cancer?
Yes, a lot of times colorectal cancers are silent cancers, meaning patients are asymptomatic. They don't have abdominal pain, rectal bleed, weight loss, for example. And by doing a colonoscopy, we're able to detect early signs and symptoms of cancer and prevent those things from happening. And so therefore, I urge everyone to talk to their primary care physician before the age of 45, just as either a consultation or referral to gastroenterologist. So therefore, they're more informed about their health and whether they would continue with the fecal test or the colonoscopy. And as I stated above, colonoscopy is the best way for cancer detection and prevention.
It's a great point about it being silent until it's really there, and the fact that you can prevent it with these screenings. So very important to talk to your physician, talk to them at an early age so that you can get on track with these screenings and prevention methods. Awesome. Well, thank you for being here today, Dr. Hoang, and we look forward to doing more of these videos with you along the way.
Well, thank you for inviting me, and take care. Thank you.